Hi everyone, I'm Erika and today I'll be talking with Amy and her grandma on women's business within First Nations people on breast cancer and cervical cancer. Amy today created this lovely artwork, so would you mind telling us a little bit about it?
Yeah, so my name's Amy. I'm a proud Aboriginal woman with cultural ties to Central Australia. I created this artwork on International Women's Day. It's called Walk With Us and it's about a woman's journey and it stresses the importance of having support through that journey.
Wow, thank you so much for sharing, Amy. We also want to discuss the purpose of this video today. So we do want to make sure you guys are aware that you do have voices within seeking a healthcare professional when you do have concerns about your body.
Yeah, so it can be quite confronting to go and seek out healthcare from westernised medical services. They don't often understand our culture and our beliefs, and it can be confronting to go in and maybe be paired with a male practitioner for concerns such as breast cancer and cervical cancer. So this video today is going to share my grandma's story and what she experienced with her journey with breast cancer, and we're going to talk a little bit about what you can do to help yourself have a better journey, whether that be requesting female practitioners or just taking someone along with you that understands your cultural identity and your cultural rights and needs.
My name is Simpson. Currently living in Mabantwa, Alice Springs. I'm a mother of 5 children, 15 grandchildren and 3 great-grandchildren. Returned to Alice Springs to my ancestral country in 2021. I went for my regular mammogram that I do on a more regular basis because my sister had breast cancer 10 years before that. So since then I get regular checkups, and I got a call back from breast screen saying there was a change in my right breast, and so they made an appointment and I went into Breast Screen Queensland and got an MRI, an ultrasound, another mammogram, and then they still weren't convinced that it wasn't anything. So they asked if we could do a biopsy. So we did that on that day as well. I went back in with the results, which confirmed that I had breast cancer, early stage breast cancer, stage 1. I was very fortunate that I had my sister with me because I think you're in a bit of shock and you don't take it all in. So I went home and told my kids that I just need a couple of doses of radiation. I didn't realise it was going to be 4 weeks ongoing. Through the whole period of that treatment, I was downplaying it quite a bit and not accepting that I actually had cancer. So they did set me up with a fantastic psychologist in oncology who talks to cancer patients, who kept telling me that I did have cancer, and I kept saying, well, it's not bad, it's fine. So it was, downplaying it because there was a lot of other stuff happening at that time also. I did feel uncomfortable in the hospital at one part when I had to get another biopsy because they said there were a couple of other lumps they wanted to investigate, which I didn't know, and that was a bit of a shock. And when I went in for that biopsy, I don't know what that guy hit, but I was bleeding everywhere and he didn't treat me very nicely, saying I was on blood thinners and, putting blame on me. But also in the space that it was in, it was made me feel extremely vulnerable. It was an open area. He didn't bother closing the curtains. He didn't give me a robe to wear. I could see people down the other end, like 2 men sitting in an office, and I was extremely uncomfortable. And it just made me think, how would people from remote areas feel coming into that space when I've worked in hospitals and I'm normally comfortable in that space and I wasn't. So I can only imagine how other people might feel. I probably would have liked a female there, And because it was just a male and me the first time, there was no one else there, and the environment wasn't, you know, a really nice environment to be in either. So I was pretty uncomfortable to start with, and then for him to stuff it up and put the blame on me made it even worse. And I did put a complaint into the hospital because, you know, worried about other women coming from communities, how they might feel. Yeah, so I would have preferred a female. So next time he did get another female, but in Breast Screen Queensland, they were all female and they were really good. Yeah, I think for any woman going through it, access the hospital liaison officers, the Aboriginal liaison officers. I wasn't offered that at the hospital. My sister was when she went through it, and she said they were great, really good help for her. Yeah, I think have them as a support, especially if you're away from home and community and country. Go in, ask for those people, set it up before you get there to make sure they're available during that time. And if they can't be, have someone else there who will speak up for you. They say the first of the month, do your breast check in the shower. Just do your regular arm up and you know, and get to know your breasts, know what they feel like.
Amy, how did that video make you feel with your grandma?
So hearing my nanny's story like that was quite hard to listen to, especially the bad experience that she did have. But it does make me concerned for other women, especially coming from rural and remote communities that have to endure that in westernised healthcare. But I think the important take-home message that I got for it, and that I hope that other mob and my family got from it, is that it is important to get it done, to go in and get screened and look for those signs that your culture is going to be respected, whether that be a poster up in the mammogram van or anything like that. And it's also important to have support, so take someone with you, whether that be family or an Aboriginal liaison officer.
Yeah, thank you for sharing, Amy. And I would just give a big thanks to her nan as well. We obviously do appreciate her coming on here today and speaking to us about her experience.